Suturing a laceration and removing sutures. Probably one of the most common procedures you will be involved in will be assisting with suturing a laceration or cut, and then the subsequent removing of the sutures. Sutures or stitches involve using a surgical thread to close a wound. These wounds, most commonly a laceration, can occur as a result of an accident or as a result of a surgical procedure. Sutures can be absorbable, meaning the body absorbs the material itself after several days. Therefore, they do not need to be removed. They can also be non-absorbable, which require the patient to return and have them removed after healing of the laceration has occurred. Sutures can be made of silk, polyester, or nylon. Most sutures are packaged with the needle attached. When assisting the physician to suture a laceration, you should do the following. Identify the patient and explain the procedure, obtaining the necessary consent, or explaining revoke. Assemble equipment, wash hand and put on gloves. Cleanse the area to be sutured as ordered by the physician. Open the suture tray or package. Most facilities will have neither disposable prepackaged sterile suturing instruments or non-disposable prepackaged sterile suturing instruments. Always maintain the sterile field. Do not touch the sterile field unless you have sterile gloves on. When the physician requests, open a package of sterile gloves for his or her use. Help to prepare the local anesthetic to be used. Cleanse the top of the vial with an alcohol wipe, holding the bottle so the physician can withdraw the necessary amount of anesthetic into a syringe. Further assist the physician by handing instrument as needed and cleaning the area being sutured of any excessive drainage. If you are touching the sterile field, it will be necessary for you to put on sterile gloves. Upon completion of the procedure, cleanse and address the wound as ordered by the physician. Clean the room and properly dispose of used materials. Document the procedure and document the patient's tolerance. Instruct the patient in caring for the wound and provide a follow-up appointment for suture removal if indicate. If the patient needs to return for suture removal, the medical office assistant may be asked to perform this duty. Before beginning the process, check the patient's charts to verify the number of sutures used to close the wound. Be certain to remove all sutures, as infection is a concern if a suture is not removed. Suture removal steps are as follows. Identify the patient and explain the procedure. Assemble necessary equipment, wash hand and put on gloves, remove any dressings, and examine the wound for proper healing. It is the physician who ultimately makes the determination that the wound is healed and ready for suture removal, or signs and symptoms of infection, such as redness, drainage, or warmth at the site. Cleanse the area with antiseptic solution, open suture removal pack, gently lift the knot of the suture with forceps and cut the suture with the suture removal scissors. Gently pull the suture toward the incision to remove it. Continue until all sutures are removed. Cleanse the area as ordered. Apply steri strips or a butterfly. These are narrow adhesive strips that can help to hold the edges of a wound together, if necessary, to further support the healing process. Properly dispose of used materials and equipment. Remove gloves and wash hand. Instruct the patient in wound care. Document the procedure. With advances in medicine, there are other options for wound closure. Liquid stitches can be used depending on the type of laceration. These are particularly helpful for young children. Suturing and the local anesthetic can be traumatic for young children. It may be necessary to restrain a young child or wrap him or her in a blanket to enable the suturing process to occur. Conclusion. In this chapter, you have learned more about the clinical aspect of being a medical office assistant. There is clinical involvement in procedures from vision and hearing screening to assisting with the physical examination. As a medical office assistant, you will play an important role in helping the physician perform minor surgeries or procedures. This may entail setting up for the procedure, actually assisting with the procedure, or even performing the procedure such as with suture removal. There are many tasks involved such as assembling equipment, cleanup, and patient education. Except for a few differences, most of your involvement remains the same and is always under the direct supervisor of the physician. Chapter 2 introduced you to many different clinical duties which occur. Depending on the type of medical practice, you may involved in many other more specialized procedures. The information presented here provides a good base for further practice and specialization. The medical office assistant who is performing clinical duties will find his or her job exciting, challenging, and ever-changing on a day-to-day basis.